Time, the clinical aspect, which is principle of wound bed preparation. Time is T, tissue, non-viable or deficient. I, infection or inflammation. M stands for moisture, imbalance. And E, epidermal margin, non-advancing or undermining. Time is observed characteristics of wound, and we have to remember that the process of wound healing is based on time. T reflects to tissue viability. Is the tissue viable or non-viable? Viable, the epithelial tissue granulation is present, and non-viable, present of necrotic, slough, and eschar. What about I, inflammation, infection? There is presence of contamination, colonized, critically colonized, and infection over the wound. M is moisture imbalance, desiccation or maceration over the wound. E stands for edge of the wound, non-advancing wound edge, which is non-healing wound, undermining with critically colonized or infected. Moving on, wound assessment, phases, hemostasis phases, inflammation phases, proliferation phases, and remodeling. Once the identification has been done, let us go into the algorithm of wound. Using the time frame for wound assessment, first, look into the tissue necrosis or slough. Is it less than 25% or more than 25%? If it's less than 25%, look into the wound infection. Is the wound infection present or no? If it's no, then we look into the moisture or exudate. Is it dry or minimal or moderate or wet? If it's dry or minimal, the wound type is 1, and if it's moderate or wet, the wound type is 2. Now, what happens with tissue necrosis or slough less than 25% but the wound infection is present? The exudate and moisture, dry or minimal, the wound type goes 3. Moisture and exudate, moderate or wet, the wound type is 4. What happens to tissue necrosis slough, which is more than 25%? Wound infection with tissue necrosis or slough with more than 25%. If it's no, look into the moisture or exudate. If it's dry or minimal, the wound type is 5. And if it's moderate or wet, the wound type is 6. Tissue necrosis or slough with more than 25% if the wound infection is present. Moisture or exudate with dry or minimal, the wound type will be 7. And if the moisture exudate is moderate or wet, the wound type will be 8. Now, we know all the wound type. What is presenting wound type 1, 2, 3, 4, 5, 6, 7, and 8? Well, these are the table shows treatment or recommendation based on the flow chart for wound type 1, which is clean, healthy, granulating wound. All types of dressing material is acceptable except for silver, charcoal, and special advanced dressing. For type 2, it is a clean and wet wound. Foam, alginate, hydrofiber, polymeric membrane may be used. Antibiotics may or may not based on the underlying cause. For wound type 3, it's dry, infected wound but less than 25% of slough or necrotic tissue. We can use Tulay, hydrogel, hydrochloride, silver dressing or iodine-based dressing. Antibiotic, yes, based on CNS report or infected issue. Wound type 4 is wound description with wet, infected wound which is less than 25%. Alginate, foam, silver, hydrofiber can be used for this kind of wound. An antibiotic, yes, need based on CNS or infected tissue. Wound type 5 is dry, non-infected wound, but the slough and necrotic tissue is more than 25%. Hydrogel, hydrocolloid, or polymeric membrane advanced dressing is needed. Stage 5, there is no antibiotic need. For wound type 6, it is wet, non-infected wound, but is more than 25% of slough and necrotic tissue. Allogenate, foam, hydrofiber advanced dressing can be used. Antibiotics may or may not based on the underlying cause. Wound type 7, dry, infected wound with more than 25% of slough or necrotic tissue. For this, silver dressing, hydrogel, hydrocolloid, iodine-based dressing can be used. An antibiotic, yes, based on CNS report or infected tissue. And wound type 8 is wet, infected wound with more than 25% of slough or necrotic tissue. Allogenate, silver dressing, hydrofiber, foam, charcoal, or iodine-based dressing can be used for this wound. An antibiotic, yes, need based on CNS and infected tissue report. And surgical or mechanical debridement is strongly recommended for wound type 8.